I'm only starting to do 24-hour urines. I'm a little slow, and I've missed that. I think I should have been doing it like David over the last 10 years, but I've relied on serum levels primarily, and I think I get good results from that in most people, but I get puzzling cases, and you're going to find that you get in some of these genetic patterns, and he knows the genetic patterns. They jump right out of the page for him, even if they're not abnormal. You look down, you say normal, normal, normal. Oh, well, the hormone pattern's normal. No, it may be high normal, low normal in certain patterns that he can point you that will really help to determine therapy. One of the young ladies was talking to me about problems with hair loss in some of her patients and so on. And yes, there are some adrenal androgen problems and so on. And making the diagnosis correctly will, the 24-hour urine is the best way. A snapshot of adrenal hormones is okay for screening, but not very accurate. Wake up. All right, we're going to move on again. Try and hold your questions. We'll go module by module, and then each time we get to the end, I'll give you a little chance to ask the questions. Pretty much it's straightforward medicine. Do your basic history questionnaire. I have it broken down here. I'm not sure whether we have the questionnaire. We might in your handout. I hope we do. That's in toto, but if not, it's in those segments. And if it's not in the printout, I have that questionnaire in one sheet rather than on all the little blocks. It's there, but I have, oh, it is there in a one sheet? Okay, good, thank you. That little sheet, copy it and make multiple copies and use it. I use that in everybody that walks in the office, and I'll tell you the value of that sheet is not in diagnostic as they walk in, but you do get a kind of a self-evaluation of all those levels. One other little vignette in men, have the wife do the same questionnaire. You get entirely different answers, and sometimes more accurate ones. Men are liars and deniers. Women are detail people. They like the intervention. They like to balance things. They like recipes. They like finding little defects. Men like to gloss over all of those things. That's true. We're terrible. We're lousy patients, and we're lousy historians. But still, that questionnaire will serve you in good stead because it's a baseline. And when they come in, you give them that questionnaire de novo again and have them re-rate themselves. They don't remember what they put on the others. And I will guarantee you, those numbers in every category of systemic function will improve if you are correcting an endocrine defect. If they need testosterone, the central nervous system, the physiologic, the physical, the sexual areas, those numbers will improve. And if you ever get in court, you have a documented, show me a placebo that affects every system in the body consistently for a long period of time. I'd like to find it. I'd like to be taking it. Placebos don't work that long or that consistently in multi-system type things. So that questionnaire will be a very useful thing in addition to your usual kind of questionnaires and forms that you have. Focus on things that might be important, such as trauma, surgery, medicine that they're taking, active disease, habits, past steroid use, and so on. All the things that I listed there, you need to keep in mind as potential interferers with testosterone. Physical exam. If you give testosterone, I don't care if they saw a urologist. If they're over the age of 40, you better have stuck your finger up their rear end and checked your prostate yourself, and do your own physical. If you're just looking at the questionnaire and doing some tests and sending them out without doing a physical, and I'm talking about a complete physical, it doesn't have to be an hour-long physical, but a brief physical, checking the carotids, the thyroid, the heart, the lungs, the belly, the testicles, and so on, and the prostate. Check peripheral pulses and so on. Do a quick physical. How long does it take to really go through that? It only takes 10 minutes to do a brief overview physical, but do it and document it. That symptom questionnaire provides a baseline for the general areas of testosterone with a number value to compare with progressive treatments. Very important. With androgen deficiency, there will be multi-system symptoms in most areas listed. Now, when you get a guy that comes in and says most of his numbers are in erectile dysfunction, but he doesn't have anything wrong with his brain, mood, systemic, fatigue, and so on, this guy probably does not have a testosterone problem. He's taken a statin, or he's got erectile dysfunction for other reasons. So you're going to find that if you really have testosterone symptoms, they will be multisystemic and consistent, and they will all improve with testosterone treatment. So if sexual problems predominate, look for drugs or other conditions that could be at the core of the problem. If physical symptoms alone, consider other causes. Now here's the rating scales, and you can put any rating scale you want, but in my book I have a little questionnaire. It's not real clear, but you can use 1 to 3 or 1 to 5. I upped it to 1 to 5 to give people a little more latitude on severity of symptoms. 0, no problem, absence, or 5, full-blown worst case scenario, or frequency versus 0 occurrences and so on. And these types of things some of them are from questionnaires that have been published, and some are just from my own experience. So this is my own questionnaire. It has no scientific validation itself, but it is based on questionnaires that have been validated. And so I'm looking globally. I'm not trying to publish anything, but it's very useful if you look at all of these areas. Pervasive sense of fatigue is the most common testosterone symptom of all. And if you've had testosterone deficiency and you replace it and your testosterone's running out, you get that pervasive sense of fatigue creeping back in. Feeling depressed, negative, burnt out, irritable, angry, grumpy old men, increased anxiety, nervousness, panic attacks. It can manifest in many ways. Neurotransmitters are all affected by hormones, and hormones are affected by neurotransmitters. Forgetfulness, poor memory, there's many reasons for that, but it'll get better with testosterone. Unable to concentrate, main focus, ADD kind of symptoms, maybe real ADD, or maybe it becomes worse. Mental sharpness, assertiveness. People perceive their symptoms in different terms. Many of these are overlapping or similar. They're just a different term for the central nervous system dysfunction. Loss of motivation, I ought to put that up at the top. These guys become couch potatoes. When my testosterone was low, I just wanted to sit down and watch TV and drink beer and just, veg. I just didn't have any initiative to get up and do my usuals. I didn't even have the initiative to get up and go out and play golf. Something was wrong. It's a pervasive sense. It affects your initiative to do your normal things that were there before, things that you like to do before, hobbies and so on. Pleasures kind of disappear, and they come back when... Testosterone question, decrease in early morning erections. Those erections don't just happen first thing in the morning with a full bladder. They're going on all night long. We sleep through most of them. If you put a strain gauge on a normal healthy male, it's showing erections all night long. The frequency of penile tumescence is a reflexogenic erection. Maybe it occurs with a dream, but most often it occurs because you roll over in bed. Or have a full bladder, or just because it's just kind of a live snake in the grass during the night. It is a biomarker of active testosterone.